Welcome to ACTPod, a podcast show that sheds light on the stories and impact of the social sector. The show is proudly powered by Aspire Coronation Trust Foundation. Let's begin the change.
Hello there. It's another exciting episode of our podcast show, ACTPod. Our story, our continent. On the show today, I'm going to be having a conversation with someone that I would call a change maker. Yeah, because she is a change maker in the space. She is a development practitioner, an obstetrician and gynecologist, and she is a social entrepreneur. Welcome with me, Dr. Abosede Lewu.
Thank you so much, Abiodun.
It's so good to have you around.
Same here. It's good to have you here too.
All right. So usually how we start is we want to get to know about you. So who is Abosede Lewu, and how did you get into the social sector space?
Okay. So thank you very much for having me. Well, I am. Let me start from the beginning.
Okay.
So I am a daughter. I'm the second child of 5. Also married. Have 3 children, and then, like you said, I'm a medical doctor and I'm a development practitioner. Basically, that's who I am. I see myself as an innovator, and beyond being a change maker, I also think I have a part to play in making my community better.
Okay, thank you very much, Dr. Abosede. So I know that you're the founder of Girlsaide Initiative. Would you like to please tell us, why do we need a Girlsaide Initiative in our world? What actually led to the founding of Girlsaide Initiative?
Thank you, Abiodun. It's a lot of things, but I can critically remember the single incidents that made me sort of know that there was a need for Girlsaide. So I was a junior registrar. I was in residency training then for my obstetrics and gynecology specialization. There was a trend that I was always seeing. So we had young girls coming into the hospital with sexual and reproductive health problems. So come sexually transmitted infections, unintended pregnancies, unsafe abortions, and all that. So it was so common that, or it is still common that, when you come for your night calls, you actually prepare for those kind of incidences to occur. So there was a particular case that really, really kind of didn't let me go. That's what I'll say. So we had like 2 young girls coming with their older sister who was literally unconscious, and they were really all young. And we asked what the problem was. They said, their sister came from the university. She was schooling in the eastern part of the country, and she came to see her boyfriend. To cut a long story short, she was pregnant, and her boyfriend was not ready for the pregnancy. I think she was 18 or 19. So she had an unsafe abortion, and suddenly she couldn't just get better. So the sisters actually rushed her to the hospital. They didn't have money. They didn't have anything, but they just knew she had to go to the hospital. I could remember that we started resuscitating this young girl. And then we kept asking these girls that, what about your parents? And then they were looking at us. We can't tell our parents. We can't talk to our parents about this. And I remember when we were wheeling her to the theater, she actually died at the elevator.
Oh, no.
And it was so traumatic because they were really, really young. And then the 2 sisters, they were stunned. They kept looking like, it was almost like they didn't understand the gravity of what happened between those 3 sisters that day. But what was most powerful for me was that even after their sister died, their comment was still the same. We can't tell our parents. We can't do anything. Then we had to start asking, so who do we call for you? You are all young teenagers, and they were younger sisters, not older sisters, by the way. And then, of course, we had to find a way to navigate that. But after that incident happened, alongside with other cases I had seen, I just had this unrest about this situation that we can't not have these conversations with our girls. We cannot create platforms where young girls can talk about their needs, their challenges with their parents. So Girlsaide sort of started from there. And we started having programs with fathers and mothers that had adolescent daughters to sort of have these conversations around sexual and reproductive health, drug abuse, going to university, career. So it sort of expanded. But beyond what that Girlsaide was the cardinal change that happened for me was that as a medical doctor, you're trained to treat, to manage. But it sort of took me to being like someone that wanted to prevent. So I kind of started looking at most of the cases. So if I'm working in the hospital, I see a lot of cervical cancer. I'm like, okay, I'm not comfortable waiting to treat these women. What can I do in the community to prevent cervical cancer? If I'm seeing a lot of women dying from hypertensive disorders of pregnancy, I'm like, what can I do at the community level to stop this influx. So that sort of mind shift that happened to me then was like the foundation of Girlsaide, and that's how we've always functioned. So we don't want to respond to problems. We want to anticipate them and then provide solutions at the very beginning to nip them at the bud.
Yes. Okay. Talk about the Changemaker that you are. That's why we're featuring you on the Changemaker series anyway. And I think that what you're doing is totally awesome, because you look at our country, for as long as I know, we know that maternal mortality, infant mortality has always been on the high. Although it's reducing, but then they're still unnecessarily high. And people die from needless, issues, You hear about pregnancies, abortion, even malaria issues, killing unnecessarily. I'd like to ask, what is Girlsaide Initiative doing to actually address these issues? Because I'm particularly interested in it because you work with girls and women who are already disadvantaged in our side of the world.
Yes.
So what is it that Girls Initiative is doing with these girls and women in your initiative?
So I need to give credit to my team that over the last 6 to 7 years, our range of interventions have increased. So we work, like I said, mostly with girls and women, or especially those from low-income community or hard-to-reach community. So one of our projects, like we've talked about the one we do for parents with adolescent daughters, we do programs around girls in secondary school, where we do a lot of sexual and reproductive health awareness, career path, and all that. But one of our big projects that we've been doing, especially that targets maternal mortality, has been Keep All Mothers Alive, which thanks to ACT Foundation, it's been sustained for a prolonged time.
Good.
And like I said, we have many causes of death in mothers in pregnancy. So it could be from bleeding, it could be from infection. We have so many range. But the one we are focused on the most has been hypertensive disorders of pregnancy. Okay. And just like we know hypertension is a silent killer, a lot of people have high blood pressure and they're not even aware of it. So that's that. But again, this also came from the place of, by the time most women that have these complications get to the hospital, sometimes it's too late to save the baby, and sometimes it's too late to save both the baby and the mother. So, and then you find out that most of these women, these diseases, you can kind of predict that they're likely to happen in certain groups of women. And you also find out that with some certain intervention, you can prevent, or at least help this woman to take the pregnancy to a better age where the baby is likely to survive. And of course, you can also prevent maternal death from that. So we started this, in the last 4 years, we've been working with the Keep All Mothers Alive, which is to train multiple levels of healthcare providers. So as it were, a lot of Nigerian women still use traditional birth attendants, faith-based. I know in an ideal world, everybody wants every woman to give birth in the clinics, in the hospital. But we all know that our reality, a lot of women still don't go to the hospitals or to the clinics. So it's about meeting women where they are, and also creating this chain of contacts between women that use hospitals and women that don't, and even service providers. So over the years, we've done that. We've trained a lot of traditional birth attendants. And what do we train, or faith-based, what do we train them to do? To ask questions and to be able to identify women that are likely, they don't even have to have had the disease, to have this and send them to the hospital. So we do our trainings within hospital settings. So for sometimes you find out that those pregnant women wouldn't have come to the hospital. But when we train the traditional birth attendants and they bring those women to the hospitals, we've already created that network.
Awesome.
And then for every trained traditional birth attendants, we connect you to a health facility. So we hear things like, we have tech to support them, our WhatsApp groups, like, oh, this woman, we asked her 5 of the 10 questions and they were yes, I'm sending her to the big hospital. That's what they call general hospitals. And so for us, that has really worked. Which they can now assess women and say, okay, and they feel very satisfied when they do send the women to the hospital, and they're like, oh, we feel good that when they went to the hospital, they were very grateful that we were able to do that. These were things they were not doing in the past. They would just wait and say whatever happens to the woman is just by chance. We also do work on even skill acquisition for women, and that has been something we've done for low-income communities when we have funding towards that, because we know that fund and health outcomes are very closely related. Poverty and poor health outcomes are closely related. So we also do training. We partner with vocational centers that can help us to uplift more women. We know that with more money that we may have, the more they are likely to do better in terms of their health indices. So we've been doing that as part of our work on maternal mortality. And of course, we create awareness in different ways that we take advantage. This is a podcast. We're doing that.
Exactly.
Newspaper articles, or sometimes we're on air talking about, we have these conversations in any space that they create for I or my team member to just talk about how do we improve maternal health? How do we make sure that girls are fit, they're old enough before they get pregnant or sexually active?
Thank you very much. You're doing a fantastic job. You know, I like your proactiveness, the fact that you are focused more on prevention than actually, you know, letting the incidents happen and then react to such incidences. I also like the fact that you mentioned that you meet the mothers where they are, because a lot of the time access is an issue for them. So when do they get out of their homes to actually go to use those health facilities? Is it at the nick of time, or is it just when it is appropriate for them to actually visit the health facility? I also love what you're doing with traditional birth attendants, because whether we like it or not, they still exist in our communities.
Yeah, they do.
There will always be some point of call for women who feel that health workers in the public facilities are usually hostile or something. You know, we have such issues, and I'm glad how you also connect them with the facility, so they're not competing with each other.
No, they're not.
Yeah, so if something is beyond their turf, then they can refer. Great.
Yes.
Okay, so I would like you to share, you know, what impact is your project having on girls and women, and maybe by extension their stakeholders, probably their peers, or maybe the parents of these girls. And if you could share one or two stories in particular, it would be nice to know.
It has been very impactful and rewarding, because one of the things we do is that for every health worker that we train traditional birth attendants, there's a follow-up process. So, you know, when we don't just train them, we also equip them with job aids that they're able to use. So when we do our evaluations 3-6 months, even a year afterwards, to find out, has this become like a culture? Has this become like a practice? Oh, yes, we now ask these questions routinely. We now check blood pressure routinely. We now make sure that women check their urine for protein. When they give us all this sort of feedback, it's really satisfying. Or we now hear things like, oh, all the women that we saw this year, we didn't lose any of them. Or we were able to refer 15 women, to the hospital. There was one that really stands out in Shomolu community that we did, where the woman, just the very day we did the training, went back and checked all the blood pressure of all our clients and asked them the question. Then the other woman, oh, she's feeling dizzy, she's not been feeling the baby kick and all that. By the time they got to the hospital, so from there, she was able to accompany the woman to the general hospital. She was, in fact, she started having eclampsia right there in the hospital. And she was like, what were the odds that within few hours of her doing that training, fortunately, the woman was able to have a cesarean session and the baby survived. So the woman was deeply satisfied that what she did in that nick of time really, really did change the outcome of that pregnancy. Like she said, if this was another time, they wouldn't have known. She would have left the hospital, gone home. It would be late in the night, and, the outcome couldn't have been that positive. And then for the young girls, it's been very exciting to see that girls that have gone through some of our training programs have gone ahead to go to the higher institutions. They are very aware of sexual and reproductive health needs. Some of them are even like the ambassadors, talking to their friends about the complications and having these open conversations. And that has been really, really satisfying. So we do follow up on the outcomes of the women we reach directly, and how much of what we're teaching these health workers are continued as practices. And for that, we think it's been very impactful. And as you know, the ratio of health worker to patients in Nigeria is really, really, really huge. So you find that for one nurse, because we also train doctors and nurses at primary healthcare center.
Oh, right.
We train them because once these people from the community send patients to you, we have a reminder course. What are the first steps you take before you send these cases to the tertiary institution? Because people still go to primary health care first. And if you look at what we have, nurses over 1,000 patients, doctors over 1 to maybe 3,000 patients. So if you're able to train one nurse and one doctor, you are going to indirectly impact thousands of patients. So it's been rewarding for us to see that. And of course, they have the job aids that they use as well. So they know what to do when these cases come from the communities to them. So such as we can put a cap on what we've done, we've been very satisfied with the impact we've had on immediately in the lives of the pregnant women that benefit from our interventions, and also the continued practices that we've seen in those that we've been training, as this is like normal culture for them now to ask these questions and refer patients early. Yes.
In fact, you have sort of taken care of what I was going to ask you next. You know how you implement projects, you provide products and services, for people, and once you are gone, maybe once your project has ended, you find that you don't see the kind of results that you've been seeing in such communities. But from all that you've shared now, I can see that the knowledge that nurse has stays with her for life, and then she can't undo it. So she keeps providing the service, as necessary, and even for the trainings that you have done, and and so on and so forth. And I'm really, really, proud of that. Okay, so I wanted to talk about collaboration and partnership in this space. We have a situation where nonprofits find that they work in silos. They compete for the very limited funding that they have available. And then it looks like they're competing against each other. What do you have to say about this? What do you think about the need for partnership in the space so that we can together, move the health development of our people forward?
So the first thing I will say is who we are as a people comes into how we run our businesses. So we're in a bit of an individualistic system where people get credit for what they do well. So, I mean, that also affects how we also run nonprofits. So you kind of see that if you're nonprofit, like I'm very excited about this, the progress, the impacts we've made. But when I step back from what we've achieved as an organization and look at the maternal indices in the country, is what we're doing like a drop in the ocean? So for me, I always say collaboration is the only way forward. Like if we're not collaborating, we're just going to keep dropping like teardrops into the ocean. So I'm sure there are many organizations working on maternal health in the country. I'm sure that we're doing a lot together. But I've started thinking more than before that how can we collaborate to make this stronger? Now, the concept of collaboration for me also in the last 1 year has been deepened, because when we look at collaboration, we look at people doing exactly what we're doing. But I've learned to realize that collaboration sometimes is about finding people that are value aligned. It doesn't have to be mission aligned. Good. So who are the change makers around you? How can you collaborate to efficiently use your resources? So yes, everybody competes for funding, competes for space to do stuff. But just taking it back to the sustainability that we just talked about, it's tied to one another. So if I'm collaborating with someone, all of us need venues. So I've started thinking about it. So we have to use venues, we have equipment that we rent, we have to provide food, we have to do all that. How about if I was going to train TBAs? There were 3 other organizations that wanted to do TBA training. What if we all did it together? Shared one venue, prepared one food.
And reach more
so
people.
We will have more funds left to even be sustainable as an organization. Because I think one of the challenges we've had with collaboration is closely tied to our sustainability. Because we always think about, I need this fund to be able to do my project. I also need this fund to be able to keep my team. I need this fund to be able to, make my organization sustainable. But if we become more collaborative, we will be able to navigate some of these expenditures together. And then, of course, when I say value aligned, you're working in a community where someone is addressing poverty. You're trying to make lives better. I can also use that vehicle to bring maternal health conversation in there. And collaboration, yes, one. Second part of collaboration is we always look at collaboration from CBO, NGO to NGO. Collaborating with private organizations is also very key. Right. Collaborating with government is also always the biggest influencer. How can what we do key into what the government has? Like we use the primary healthcare centers, which are government institutions. It's our own way of institutionalizing our interventions through collaborating with the state government or in some cases federal government. So collaboration is key. If we keep doing it on our own, we will not be able to scale up at this rate we want to scale up, and our reach will also be not as far as it will go. So I totally agree, collaboration, but there's also a distinct challenge between, am I collaborating at the expense of sustaining my own organization? Right. So this is now where the challenge comes in. But collaboration is definitely a must for us to progress.
Okay, yeah. And I have taken that point really clearly. Thank you so much for making that clear. So as we round up, I was also going to ask you, yes, we're here in Nigeria and we know that the problems that we're faced with, it's a lot of them. Looking at our policy environments in Nigeria, for example, what is your take about the public sector? Do you think that our governments are actually standing up to the challenges that we have? Do you think that they're doing enough? Do you think there's something they could do differently? Or what is your take about this?
Well, things can always be better. I mean, if we first start from the budget, most times the budget allocated to health is 4% or 4 point something percent. That is not enough. If you calculate it in naira, each citizen is entitled to about 3,000 naira per year. That is not even enough to get a very good antibiotic. So you can already tell where we have challenges in the health sector. So when we say what else can we do, or what else can the government can do a whole lot. Or we wish the government would do a whole lot. But we now have competing needs. We have insecurity, we have education, it almost feels like every sector's need is compelling. So what can the government do? When I think about it in my spare time, I think about it that government can first start by making investments in health easy. If you want to provide fundings for those that are interested in investing in health sector, you want to give them tax reliefs or waivers. Yeah. You want to make sure that maybe funding available to health sector has lesser bottlenecks than other sectors. That is very, very critical. Another thing is government has to be very intentional about retaining talent, medical talent in this country. We are now talking about brain drain from doctors, nurses, physiotherapists, scientists, paramedics. Everybody knows that there's a better option in other parts of the world. Right. And nobody wants to live in poverty. So what is the government doing currently to retain medical talent in this country? That is also very important. Another thing that I always also say is that the government also has to see that NGOs, private sector, they are also stakeholders in the health sector. True. So how are they listening to us on the ground? Are they writing policies from up there or from people that actually do interact with patients, that interact with communities? They should be more intentional about bringing their voices into the policy space that has to do with health. And I'm going to also chime in that it's not only government, because we all have civic duties as citizens as well. So I also use the same to say, what about organizations? Organizations should also have policies that favor health. We have a lot of huge organizations, both local and international, that sponsor a lot of things, which we're very excited about. They sponsor entertainment, they sponsor TV shows. They can also sponsor health interventions. Right. I mean, it's not as glamorous. It's not as picture perfect. It's not going to give you the brick and mortar that you see, but these are valid impact that can also be made. So I think organizations can also invest in health. They can also create policies to even make their staffs healthier as well. From exercising to providing funding to support that, mental health, physical health, even from every cadre of health worker, making sure that they have insurance. We've talked about universal health coverage. Government has not been able to achieve it, but a lot of people work in private organizations. How are their companies trying to ensure that all their staff also have some sort of coverage? And then when I talk about government organizations, then I talk about individuals. So philanthropy is not for wealthy people only. We can all be philanthropic. Right. If you go into any hospital, you will find people that are there that can't buy food. This was like, if you've seen anyone that's done residency in Nigeria or worked in the hospital sector, we've lost count of the number of times we have to take money out of our pockets to pay for a patient to be able to eat, to even use their drugs. So there's time for their medication, but they've not had a meal, so they can't use their drugs. Some of them just need like one extra drip. So if you go into the hospital spaces or even health sector, you find that so long as you have an income, something as small as 1,000, 2,000, 3,000 can actually make a huge difference. So if you want to talk about policy, we talk about government, organization, and even individual policy. What is your take? We all have, it almost feels like we can't meet all our needs, but we also have things that we do that at once. Once in a while, we can just say, okay, this month, I'm going to give my 5,000 to someone that needs it. You'll be surprised at how heavy huge the impact that is going to make. So those are my musing on policy. I feel like we all have a part to play. It's not we are a government too,
yes,
so
we do.
We can do something.
We do. And I like how you've responded to that. Not just leaving, not just dumping the responsibility on the government. So we have the private sector, and then even we as individuals. What exactly are we doing to ourselves? Okay, finally, we know that ACT Foundation has been funding Girlsaide or partnering, so to say, with Girlsaide for how long now?
4 years now.
4 years. Okay, great. So how has this partnership relationship been? How have you grown through the years, partnering with ACT Foundation?
I want to take like a long time to say all this. So I will say that ACT Foundation has been an amazing partner with Girlsaide. And I say this from a place of knowing, even now having a deeper understanding of what being a sustainable organization is. Prior to that, I used to think like if you say an organization is sustainable, we have funds to do project, that's what it means. But we had a lot of trainings with that foundation. Oh, you guys can train. And then, so you find out that when we talk about sustainability, we are now talking about how sustainable are you as an organization? How can you retain talent as an organization? What is your capacity as an organization? What I found out over the last 4 years that we've been with ACT Foundation is, apart from the funding, is that they've helped us to become a sustainable organization by sort of investing in trainings for different, from finance to communications to storytelling to narrative. It has been exceptional. Then one of the things we've talked about at other times has been that most funding being one-offs. For us, we've been with 4 years. Sometimes you realize that impact takes a while for you to measure them. Sure. So sometimes you do like a single event. It's great at the time, but how do you follow up over the years? So I feel like while sometimes people talk about broadening your scope, our partnership with ACT Foundation has been broadening and deepening. So in most of the communities we work, we're like part of those communities, and that's because we'll be able to go back there annually and each time to say, okay, how do we follow up? How do we get a feedback from the community and take it back to ACT Foundation? And ACT Foundation has also been very responsive in our partnership. So whatever you find on the field and you give a feedback to ACT Foundation, there's flexibility for you to make changes. One of the things that happened over the last 4 years was now we've started getting patients from these communities that the TBS tell us that, oh, this woman has really had bad outcomes in the last 3 years. So we're handing over this woman to you for care. And so we came up with something we call Belly to Baby, which is to help high-risk pregnant women from the beginning of the pregnancy throughout. And ACT Foundation has also provided funding for us to be able to do that. So it's been a great relationship. We're looking up to more years together. Yes. And like when I tell people, I'm like, look, ACT Foundation doesn't fund. We're not like a one-cycle funder. This is like we're doing great work together. So they always provide support. They are also flexible. They understand that life happens and there are nuances you find in the communities, and they are willing to move with you. And whenever you drop the ball, they're also willing to sort of help you pick it up, because of course, every relationship you have some challenges here and there. But even whatever the challenge is, they are willing to say, okay, how do we solve this problem with and for you? So I'm grateful. We are all grateful at Girlsaide Initiative to ACT Foundation.
Oh, yeah. And we are grateful to you as well. Courtesy partners like you, we have impacted over 2 million people across Africa. And we're just 5 years old, so we can do a lot more even, as we go on. Okay, thank you so much, Dr. Abosede Lewu. It was really nice having a conversation with you. And that is where we call it a wrap for today's show. Do stay tuned next time. Bye.
Bye. Thank you.
Thank you for listening to ACTPod. For inquiries and feedback, please reach us on actpod@actrustfoundation.org. Follow us on social media at ACTFoundation_ on Instagram and Twitter, and Aspire Coronation Trust Foundation on Facebook. The show is proudly powered by Aspire Coronation Trust Foundation. ACTPod, our story, our continent.